Hello everybody, my name is Francesco Maisano and I am the head of the valve clinic at the University Hospital in San Raffaele, Milano. At the beginning of 2020, we have been confronted with an unexpected challenge. We have been underestimating the risk of pandemic in Western countries, and almost every country has been found unprepared. At that time, I was leading the cardiovascular surgery division of the University Hospital Zurich, and even if Switzerland was very well equipped for pandemic, still we got immediately threatened by unknown challenges, by unpreparedness, and by a number of doubts. Italy was in the middle of the crisis, and we sent ventilators to northern Italy while Switzerland was preparing, and at that time the situation was very quiet. But soon after, the cases started to rise. The immediate response to pandemic was to obtain immediately the largest number possible of intensive care beds available for patients who needed to be ventilated. So there has been a request to postpone elective cases. Patients have been asked not to go to the hospital for follow-up visits. We all thought this would be temporary, but the condition did not resolve so fast. Our hospital reacted establishing crisis units, as well as me and my team decided to define clear algorithms for patient selection to keep the door open. We never closed the door to emergent cases, to urgent cases like aortic dissections, transplants, endocarditis, acute coronary syndromes. But after a few weeks of treating only emergencies, we started to realize that we had to offer surgical services to structural heart patients, mainly aortic stenosis patients who had severe symptoms. So, to reduce the intensive care unit bed utilization, we decided to lower the threshold for TAVI and other catheter-based procedures. This way we've been able to treat more patients using very few ICU beds and leaving beds available as a buffer in case there was a need. The use of less invasive procedures, together with a clear differentiation of COVID-free areas within the hospital, together with strict sanitary rules, allowed us to treat many patients, and we saw very few cases of in-hospital COVID cases who immediately resulted in quarantine of the involved patients and personnel. It has been a lot of work. We have been able to overcome the crisis, but we have seen so much suffering, solitude, and barriers to care that bring me to few key messages. We need to be prepared because cardiovascular disease treatment cannot be delayed. We have today less invasive solutions that may save resources and can be preferred in times when ICU beds are important resources. But last but not least, we work hard, but there is no alternative to vaccination. So there is only one way to keep patients out of ICU beds, and this is to vaccinate as many people as possible, whenever possible, so that we can keep living a normal life and keep taking care of our patients.